and they have dramatic impacts on patient outcomes. I've had patients that come in paralyzed, can't speak, can't see. We do the
Yes.
procedure, we open up the blockage, restore the blood flow to the brain, and
Wow.
in an hour they're back to where they were.
Welcome to Season 2, Episode 15 of the Home Healthcare Today show. I am your host, Dr. Cleman Moorer. It is World Stroke Day, October 29th, 2022. We have the distinct honor and pleasure today to have Dr. Sunil Sheth. Dr. Sunil Sheth is the director of the Vascular Neurology program at UT Health Houston McGovern Medical School. Dr. Sheth, welcome to our show today.
Thanks so much for having me, Dr. Moore, and also thank you so much for doing this segment.
Wonderful. Thank you, sir. Dr. Sheth, for those that aren't quite familiar with the prevalence of strokes, I want to provide some statistics for our
Yeah,
listeners and viewers.
please do.
Yes, sir. In 2020, 1 in 6 deaths from cardiovascular disease was due to a stroke. Every 40 seconds, according to the CDC, every 40 seconds, someone in the United States has a stroke. Every 3.5 minutes, unfortunately, someone dies of stroke. And then every year, more than 795,000 people in the United States have a stroke. About 610,000 of these are first or new strokes. Dr. Sheth, from your research and your expertise and knowledge, what are some of the warning signs as well as some of the drivers for so many stroke victims in the United States?
Yeah, very, very sobering numbers, isn't it, Dr. Moore?
Yes, absolutely.
And just one comment on that too is that I think we focus a lot on the mortality, meaning the death that comes from stroke, but sometimes
Yes.
what stroke does is it doesn't result in death, it results in severe disability. And at
Yes.
times that can sometimes be worse.
Yes.
What the disease does is it can strip you of who you are as a person. Of course, people are aware of symptoms of weakness and numbness and trouble speaking,
Yes.
but we'll go through those because it's worth reviewing.
Yes.
But it affects the brain, which is also who you are as a person, and so you may forget, some of the most cherished memories of your family, childhood, growing up, or lose the ability to recognize your family members, and so this is some of the more devastating consequences of stroke, even beyond mortality, even beyond death. So very, very not just deadly, but devastating disorder. But to go through some of the symptoms, which
Yes.
can be often overlooked,
Uh-huh.
or people sometimes ignore them,
Yes.
and so would love to go through those with you. And there's some acronyms that have been developed. I think the one that's probably the most popular now is Be Fast,
Yes.
because again emphasizes that time is so important.
Mm-hmm.
But so for Be Fast, we'll go through those letters. So the
Sure.
B stands for balance.
Balance.
So
Yes.
trouble with walking or trouble coordinating your hands. The E is for eyes. So
Yes.
loss of vision, blurry vision, double vision, one eye or either eye.
Yes.
The F, so now we're on fast. So the F in fast is for face. So
Face.
drooping your face,
Mm-hmm.
slurring your words because your face isn't moving symmetrically.
Yes.
Then the A is for your arm. So weakness of the arm, can't lift your arm, or the arm is drifting, or even just your hand, you're dropping objects, can't pick up
Yes.
your keys, can't button your shirt.
Mm-hmm.
Then S is for speech. So again, we talked
Speak.
about slurring your speech, but it could also be you can't think of the words you want to say, the words can't come out of your mouth properly, or you can't understand what people are saying.
Yes.
And then finally, T is for time,
Time.
because time is so important. And just to
Yes.
reemphasize the importance of speed.
Absolutely. Yes, sir. Thank you, Dr. Chef. So as we think about Be Fast, the acronym Be Fast, we want listeners and viewers to be watchful of the symptoms of balance and imbalance, the eyes, right? Perhaps drooping of the eyes, right? As we get to fast, face, changes in the face, drooping of the face, one side or both sides, drooping. Arms, you mentioned, Dr. Sheth, not being able to necessarily grasp an item or having full movement. Speech, it's very important that not only did you mention slurred speech, but the cognitive ability to be able to find the right
Exactly.
word,
Right.
very
That's right.
important. Yes, sir. And in view of all of those letters of the acronym, the time, moving fast when a person actually sees these cognitive as well as mobile changes in a loved one.
Right.
Doctor, are there some perhaps lifestyle choices, or are there some habits that make some individuals perhaps more perceptible to or susceptible to actually experiencing a stroke?
That's a great question. And one, not so great piece of news is that we're seeing stroke in younger and younger people these days.
Yes,
And uh, a lot of that has to do with the same risk factors that people were developing earlier in life, we're now seeing, oh, sorry, that were developing later in life, we're now
yes,
seeing earlier in life.
yes,
So, and I think many of these things are things that people are getting aware of because they can also cause heart disease.
yes.
So, to be more specific, I'm talking about things like high blood pressure.
Mhm.
In our diet, there's lots of salt, uh, lots of reasons that people have high blood pressure. Cholesterol is
Yes.
another. High cholesterol can also cause heart disease, cause any kind of blood vessel disease.
Mhm.
Certainly, same for brain vessel disease that can cause stroke.
Yes.
Obesity. So, as you get heavier, um, there are many other changes in your body's metabolism.
Yes.
Diabetes goes along with that too. So these are all risk factors that I think people are aware of. And then some other ones just to go through are smoking
Yes,
is,
sir.
is a is a problem. Any kind of real tobacco usage, and then a few other ones that people are maybe less familiar with. But sleep apnea, we have some
Yes.
data that
Mhm.
obstructive sleep apnea, if you're not getting good oxygenation, good rest at nighttime, that's also a risk factor. There are also things that can run in families. So
Yes.
there are some, we don't know the exact gene, but we know that there are certain types of stroke syndromes that can run in families. And so if you are someone who in your family, your uncles, your aunts in their
Mhm.
50s and 60s are already developing heart disease, may have had stroke,
Yes.
then this is a reason to be more vigilant for your own health.
Absolutely. Thank you, Dr. Chef. And out of those non-modifiables in terms of genetics and heredity, you know, recognizing that perhaps there is a stronger possibility or likelihood, but where we find a lot of hope and courage is looking at what is modifiable. So when it comes to diet, exercise,
Mhm.
rest management, moving away from smoking,
Mm.
and the like, and then of course watching our weight, right? Watching our waistline as we think about obesity and managing cholesterol. Very very helpful. Um,
Absolutely.
Dr. Chef, our primary stakeholder group are the homebound, so the individuals that may already have a debilitating illness that prevents them from getting out of the house as much as they would like to. What can some of my caregivers do as they begin to think about being more watchful of homebound patients out there that may perhaps have had a stroke or are recovering from a stroke, right? Or are at greater risk? What could caregivers do to be of greater support?
Yeah, it's great. It's a great question. Obviously, a very, very important population too. I
Yes,
think for patients who have had a stroke
yes,
recently and they have disability because of that, I think a few things to be mindful of is one is trying to trying to move, trying to use your brain, trying to use the functions that you've lost,
yes,
especially in the early months after you've suffered the stroke. It's very important for long-term recovery. So the more effort you're putting in at the beginning, uh, the better you'll do in the long run. So
sir.
being supportive, being encouraging, and working through is important. I think the other thing that goes along with that is trying to be very positive. You
Hmm.
know, as we started in the beginning of the segment, this is changing who you are as a person. It can be incredibly depressing.
Yes.
It can really affect your mood. It can affect the mood of everyone around you.
Hmm.
But trying to be as positive as you can, at least to the extent that you're able to participate in therapy and work towards a recovery, I think is very, very important towards having ultimately as good of an outcome as possible.
Beautiful.
The other thing to think about again is stroke can recur, and so I think if if there are new symptoms that are coming, to be vigilant for the same things that we were just talking about earlier on that
Yes,
E-fast acronym, because it can come back, and these are
absolutely.
things that we may want to treat or may be able to help with when they come back.
Wonderful, wonderful. Hey, Doctor, you've been so generous with your time and insight. I know you have a very busy schedule there. As we wrap up the close of this particular segment in honor and view of World Stroke Day, Doctor, send us out on an optimistic note. Some of the developments, some of the hope and encouragement that you are seeing through research and practice to give our listeners as well as our viewers a ray of hope on World Stroke Day.
Yeah, so first,
Yes,
I just want to thank you for doing this segment and
yes,
increasing
sir.
stroke awareness. I think that is by far the biggest thing we have to work on in this
Yes,
field
sir.
is getting people aware, getting into the hospital faster. The good news is
Yes.
for people who can come to the hospital quickly or are able to get to the right facility, we actually have really nice treatments for stroke these days, which we didn't have even 10 years ago.
Yes.
For the people presenting with some of the most severe disabling strokes, we're able to now open up these blockages in the brain that are causing the problems with these procedures
Wonderful.
called thrombectomy. Minimally invasive, can be done sometimes very quickly, and they have dramatic impacts on patient outcomes. I've had patients that come in paralyzed, can't speak, can't see. We do the
Yes.
procedure, we open up the blockage, restore the blood flow to the brain, and
Wow.
within an hour they're back to where they were. So
Yes, sir.
really, really is a new era here in the last
Hmm.
decade that we're able to substantially help people get to
Yes,
the
sir.
hospital quickly, and we have a lot of options in terms of treatments we can deliver.
Wonderful, Dr. Chef. Well, hey, it's great to hear that there's outstanding treatments in place, and in some cases, cures for folks that have had a stroke, but most importantly, prevention, right? So, thank you.
Absolutely.
Yes, sir. Thank you so much for giving us some of that great insight and energy about a wellness program, wellness agenda, focusing on prevention, but the ray of hope in the event that one does suffer. There's a lot of great help out there. Thanks so much, Dr. Shah.
My pleasure. Absolutely. Really appreciate being here. Thank you.
Yes, sir. And happy World Stroke Day to you and your
For
colleagues.
Thanks so
Wonderful,
much.
sir. My pleasure.
Bye.
Thank you, Doc.